Hello everyone, my name is Te-Chun. Today, my topic is telehealth, a solution or a risk, a comparative analysis of Taiwan and US healthcare. In this presentation, I will compare Taiwan and the United States and discuss the supporting views as well as the concerns and the opposing opinions about telemedicine. Through this comparison, I hope we can better understand telehealth's role in future healthcare. Here is the outline of my presentation. I will begin with the background and the news report, then explain what telemedicine is and the global trends. Next, I will introduce the supporting views and the concerns or opposing opinions from both Taiwan and the United States. After that, I will compare the two countries and discuss the impacts on healthcare, society, and policy. Finally, I will share my own perspectives and reflections on this topic. First of all, I will begin with the background and explain why telemedicine has become an important issue in both Taiwan and the United States. Before comparing Taiwan and the United States, I want to explain why I choose this topic. In 2024, Taiwan officially implemented the Telemedicine Act, bringing remote care into the national health insurance and raising discussions about the accessibility and medical quality. During my clinical observation in Southern California from October 17 to November 2nd in 2025, I saw that telehealth was widely used for chronic follow-ups, discussing test results, and even pre-operative consultations. However, some experts also shared their concerns. The main worries were telehealth provides limited diagnostic information, and patients' prognosis may be affected. Because of these differences, I want to compare Taiwan and the US and think about whether telemedicine is truly a solution or a practice that still requires caution. Before moving on to the comparisons, I will outline the basic concept of telemedicine and its development in the global healthcare systems. Telemedicine refers to providing medical care without requiring an in-person visit. Through cell phone calls, video consultation, and digital platforms, patients can receive follow-ups, consultation, and certain type of medical assessment remotely. Although the pandemic accelerates the adoption, many countries have continued to expand telemedicine even after COVID-19, especially in areas such as chronic disease management, mental health service, and test results discussions. This approach not only reshaped clinical workflows, but also changed patient expectation about how medical care can be delivered. Next, I will move on to the argument in favor of telehealth. I will first use Taiwan as an example to explain why, under population aging, rural health needs, and long-term care demands, the government and some medical professionals strongly support the development of telemedicine. In Taiwan, there are several key reasons why telehealth is strongly supported. First, telehealth improves access for rural and elderly populations. Government data show that remote consultation service now cover many mountainous and offshore townships, serving over 100,000 patients and allowing them to connect with specialists at medical centers without long-distance travel. For older adults who rely on family members to accompany them, this greatly reduces both physical and emotional burden. Second, it offers greater flexibility for chronic disease follow-up. With video or phone consultations, patients can contact the doctors more easily without traveling to the hospital every time they need to adjust medication or review test results. According to Taiwan's Ministry of Health and Welfare, telemedicine has been officially included in national health insurance for chronic disease management, post-discharge follow-up, and home-based care, which helps reduce the interruption of the treatment. Third, telemedicine helps alleviate physicians' shortage in remote regions. Reports on 5G telemedicine in rural Taiwan points out that by using high-speed network and real-time monitoring devices, tertiary hospitals can support local clinics and community hospitals, improving access to emergency and specialist care while avoiding unnecessary transfer and extra cost. Finally, telehealth is also viewed as a driver of digital transformation in healthcare. The development of teleconsultation platform, home monitoring devices, and cloud-based medical records not only benefit individual patients, but also pushes the entire health system towards smarter and more integrated care. In the United States, the supported views of telehealth are shaped by medical culture and geographic need. Telehealth includes video, phone consultation, and email, but for follow-up visit and reviewing test results, phone calls are more commonly used. As explained by Dr. Margaret Shao, phone follow-up are faster, more efficient, and in many cases, patients are not charged, which makes them highly acceptable. Second, telehealth greatly reduces time and travel burden. Many American patients need to drive 30 minutes to over an hour to reach a hospital, so completing simple visits by phone or video is much more convenient. Third, the U.S. has many medical deserts. According to JAMA Surgery 2024, these areas often lack specialists, and telehealth provides quicker access to expert opinions, helping prevent delayed treatment. Finally, large health systems such as Kaiser and Keck Medicine offer highly integrated telehealth platforms, allowing scheduling, consultation, and follow-ups to occur within one single system, which further increase adoption. In the following section, I will summarize the concerns and opposing views toward telehealth in both Taiwan and the United States, including clinical limitation, patient safety, system barrier, and cultural resistance. In Taiwan, the concern about telehealth mainly comes from clinical limitation, user barrier, and the system design. The first issue is the lack of physical examination. Important assessments such as palpation, accusation, or neurological exam cannot be done remotely, so physicians often worry about that telehealth may lead to incomplete evaluation, especially for the complex condition. Second, there is a clear digital divide among older adults. Many elderly patients are not familiar with the video platforms or digital devices, and the steps required for logging in or setting up cameras can create new difficulties instead of reducing the burden. Third, one of the biggest concerns from clinicians is that telehealth does not match Taiwan's NHI point-based system. Remote consultation usually requires more time for the communication and the technical setup, but the reimbursement remains nearly the same as the in-person visit. This misalignment reduces physicians' willingness to adopt telehealth on a larger scale. Lastly, liability. The liability remains uncertain. When a delayed or incorrect diagnosis occurs due to the limited remote information, it is still unclear how responsibility should be assigned. This lack of clarity makes clinicians cautious. Overall, these concerns do not reject telehealth as a concept, but reflect real clinical challenge and the need for better system alignment. In the United States, several concerns shape the opposing views toward telehealth. First, cultural resistance plays a major role. From my conversation also with Dr. Margaret Shao, some physicians prefer in-person visits because moving patients online may reduce clinic value, while some patients simply distrust online care and insist on face-to-face consultation. Second, according to Alex Chen, the CMO of HealthNet, patient prognosis after remote-only follow-ups was worse during and after the pandemic. As a result, the insurance company reduced reimbursement for telehealth to encourage physicians to bring patients back for in-person care. Third, U.S. regulation remains highly fragmented. Medical license cannot cross state line, and the telehealth rules differ across states, making national adoption difficult. Reimbursement policies under CMS and private insurers are also inconsistent. Lastly, the Department of Justice have reported increasing telehealth-related fraud, where phone or video visits were used to bill Medicare inappropriately. These cases raise public concern about safety and credibility. Next, I will compare Taiwan and the United States in their development of telehealth and highlight the key challenges that both countries continue to face. This will help set the stage for the impact analysis later. This table highlights the structural differences between Taiwan and the United States. but what matters more is how these differences shape the actual use of telehealth. In terms of regulations, Taiwan unified system allows telehealth policy to move in one clear direction. In contrast, the U.S. relies heavily on state laws and individual healthcare networks, making nationwide adoption uneven. For payment insurance, Taiwan's single-payer system provides predictable reimbursement. In the U.S., access often depends more on the patient's insurance plan rather than on the medical need, which creates inconsistency. Regarding the user group, both countries include rural and elderly population, but for different reasons. In the U.S., telehealth often fills a true gap in access, while in Taiwan, it more often improves convenience rather than serving as the only option. The limitation also differed. Taiwan struggled more with digital literacy among older adults and legal responsibility, while the U.S. faced fragmented regulation and increasing healthcare fraud. Both Taiwan and the U.S. face similar challenges in telehealth, balancing convenience with clinical accuracy, supporting older adults who struggle with technology, protecting data security, and maintaining consistent care quality. These issues remind us that telehealth requires thoughtful design, not just rapid expansion. And then I will discuss the impact of telehealth from medical, social, and policy perspectives, and highlight how these influences reveal the differences and limitations in how each country develops telemedicine. Telemedicine has reshaped clinical practice in several ways. In some areas of the United States, hospitals do not have on-site ICU physicians. Dr. Te-Chun explained that these hospitals rely on tele-ICU service, allowing critical care doctors to support patients remotely, even when they are temporarily aboard. In radiology, this shift is even more established. Dr. Marisa Zeng shared that she has been working entirely from home since COVID, showing how telehealth can become the primary work model for certain specialties. At the same time, telehealth increased reliance on patient-reported information. When I ask about several physicians in Southern California whether they worry about patients giving inaccurate descriptions, they say this is generally not a concern. Patients have no reason to provide false information because it would only lead to incorrect medical decision and ultimately harm themselves. However, even with honest reporting, the absence of physical examination can still make some conditions difficult to assess. As a result, telemedicine brings greater flexibility and efficiency, but also introduces unavoidable uncertainty in clinical judgment. On the social level, telehealth is changing how people expect to receive healthcare. In the U.S., many patients see phone or video visits as a normal part of care and return on-site only when necessary. This creates a more flexible and everyday style patient-provider interaction. In Taiwan, people still rely on seeing the doctor in person to feel safe, so acceptance of telehealth is lower. I see this as a cultural differences rather than a technical issue. As telehealth becomes more stable, it may also help families participate more in care, especially for chronic and long-term conditions. From a policy perspective, telehealth pushes government to rethink how healthcare resources should be organized. In the U.S., insurance companies play a major role. For example, reducing telehealth reimbursement after COVID, which directly shapes physicians' behavior. In Taiwan, rural shortage and rising long-term care needs make telehealth a necessary support rather than an optional service. Telehealth also brings attention to system integration, such as unified platforms, data exchange, and future AI-assisted tools. This shows that telehealth is not just a technology, but part of a broader plan for the healthcare ecosystem. Finally, I would like to raise several questions for Taiwan's future development of telehealth. These questions come from what I observe in United States and point to the area where Taiwan may need further discussion. First, although Taiwan is small and travel is easy, telehealth still has its value. It should not be expanded broadly, but should focus on groups with real needs: rural residents, older adults, long-term care users, and the chronic patients. Second, platform usability is still a major barrier in Taiwan. In the US, clinics use both phone and video, but Taiwan's restriction and lack of unified interface create difficulties for older adults. I believe Taiwan should recognize phone follow-ups as an accessible and acceptable option, especially for seniors. Many older adults feel like they must see the doctor's face to feel safe, but in reality, phone consultation work well in the US and significantly lower the barrier for telehealth. Third, policy incentives should be adjusted. Telehealth should not be pushed aggressively, but reimbursement should not discourage physicians either. Reasonable incentives should be provided only in situations where telehealth is truly appropriated. Finally, telehealth needs clear boundaries. It works well for chronic disease follow-ups that result in explanation, long-term care, and home-based medicine. But acute condition or cases requiring physical exams should stay in person. These reflects represent what I have learned from observing telehealth practice in the United States. And here is the reference. This is my presentation on telehealth and my reflections from both Taiwan and the United States. Telemedicine offers many opportunities, but it also brings important challenges that we must address. Thank you for listening, and I hope this sharing provided some new perspectives.